So with new patient, first thing you do is the doctor sits down in the chair. Patient's sitting next to the blood pressure cuff, and usually what I do is I'll hook them with the blood pressure and the pulse ox first, and then I'll ask them the questions that need to be asked. It's written on the wall. After that, I'll write down the blood pressure, and the less you say to them, the best it's going to be. If you go ahead and say this is your blood pressure, then you have to hear them, well, I took my medication today, so write it down, don't explain to them. Then the best thing is to actually have them stand up and get their height, take the chart or take the measure and get their height, and then you're going to just have them stand in the middle of the door and get their posture. So if they have a high right shoulder, you're going to write that down and let them see that you're actually looking at them. So do things like this and look at them, and have them face the wall of the other side, so you can do a side view of them, and this is to see if there's any forward head posture. Again, let them see that, and then have them sit down and do the range of motion. So during this time when they're getting blood pressure, I'm getting their information into the computer for range of motion. So that should be all done in around 2 to 5 minutes. Okay, so it should be really, really quick. And the best thing is to limit any chit chat with them. If they say anything about their condition, they want to just explain everything, yes, I'll write that down for you. Yes, I'll tell the doctor about that. Okay, so just close all conversations. And you're gonna get patients you really want to coddle. You're just not going to be able to. You're just going to say, I'll write that down for you. I'll let the doctor know.
So when you bring a new patient back, the first thing you want to do is have them sit down in the first chair, because the blood pressure cuff is pretty short and it only reaches that first chair. We sit down, kind of look over their file. You can see if they're coming in for cervical or for lumbar. You grab that sheet, turn on the range of motion program. Then you start with your questions. You could ask them if they've ever seen a chiropractor before. If so, how long or how far along was their last visit. If they have a pacemaker or a pain diffuser or anything electrical in their body. You also ask if they're up to date with their cholesterol testing, colonoscopies, pap smears for females, prostate exams for males. You ask them if they have had their flu shot. If they begin to ramble on and tell you about their entire life story or their complete medical history, you just let them know that they can save that for the doctor. If not, they'll have to repeat themselves twice. You're just there to do vitals, ask a couple of questions, get a range of motion, just to get the doctor in quicker. When they hear quicker, they tend to, okay, so they can get out quicker and go about their day. Then you go ahead and hook them up to the blood pressure cuff. While the blood pressure cuff is reading, you could also put the O2 sensor on. Then you sit back down, you can plug their information into the range of motion. While they're completely quiet, if they start talking, you could ask them to stop talking, make sure their legs are uncrossed while the blood pressure machine is going off. If not, they might have a higher or a lower reading than normal. Once that is all set up, you can get them off of that blood pressure cuff, have them stand up, get their height. Before they sit down, go for a posture assessment, where it's actually on the sheet for the posture assessment. You really want to focus in and make sure that they know that you're paying attention to them. Kind of walk around them and see if they're, one shoulder is higher than the other, one hip is higher than the other, foot flares, their head posture, if it's forward tilting, backwards tilting. Then you can have them stand in the center of the room, face them opposite way, hook up the range of motion machine and get that range of motion going. If not, have them sit down and do a cervical range of motion. At that time, they're all done. You tell them to have a seat, and the doctor will be right in with them, and it's just basically in and out. You don't want to really sit there and have a full-on conversation with them.
Doing a new patient, first thing is I'm going to look at the chart before I go into the room as a doctor. I'm going to see how long they had this for, if they had any images, what their interpretation of the problem is. So if it's low back, I'm going to see where they put the marks at, the numbness and tingling. So I'm going to kind of understand, okay, does this happen from sitting, does this happen from standing, how, what, and why. I'm getting that in my head before I actually get started. Next thing is to do, when I walk in that room, I'm walking in with authority. My tone is real serious. I'm not their friend. I'm not going to go, hi, how are you doing today? That's not going to happen. I walk into the room. I don't even give them a handshake or anything. I walk around the room, I sit down, and I'll say to them, so it looks like you have some low back pain. Can you tell me what you've done for that so far? Okay, and then let them talk. They tried pain management. They try anything, and I'm controlling that whole situation. What I do is I narrow in on them, I lock in on them, so I can literally control them to stand up, to sit down. I have control of the conversation, okay? Once they get control of the conversation, they get control and they tell me what to do, we've totally lost them as a new patient. So we have to come in that room and I take control. So I sit down and I control the conversation. I don't let them, you know, start elaborating and tell them this. Once I give them the open book, they're just not going to stop, and they're going to tell me what they want to do, what they want done, and that's not going to, we can't allow it to happen.